You can bring on our next patient now.
Good morning, Miss Saunders. You can have a seat, and Dr. Smith will be right in to see you.
Hello, Miss Saunders. My name's Dr. Smith. It's so nice to see you today.
You too.
I see that you noted on your paperwork that you came in for oral rehabilitation. Is that right?
I know I'm here for help because I just got my cochlear implant like a month ago. Is that the same type of thing?
Yes, to a point. It is similar. As you know, you have access to sound with your cochlear implant, but understanding these sounds takes a little more than just hearing. So it takes visual cues, learning to listen again, and speech reading. So unlike hearing aids, which I know that's different from your cochlear implant, but just to show an example, which they amplify and balance and improve incoming sound, cochlear implants send the signals, which are electrical signals, that represent sounds directly to your brain. So the only downside to this is that it takes time to understand the meaning of the signals. The cochlear implant may start the hearing process, but your brain does the bulk of the work. So some cochlear implant users begin to understand speech right away, while others require months or even years to really have their brain adjust to the cochlear implant. I can give you a handout, and this is going to give you a lot of insight into oral rehabilitation and what you can expect going into the process.
Okay, thank you.
Yeah, and then this is Miss Walker.
Hi, I'm Miss Walker. I'm going to be your speech pathologist today. So as Dr. Smith was talking about, typically with the hearing process, we use our ears to understand speech. Because of your cochlear implant, this process becomes a little more complicated. So to help with that, we have a strategy. It's called speech reading. Have you ever heard of this before?
I don't know. I mean, I know I've been kind of listening to people for so long, just by not listening, but like reading people's mouths. Isn't that kind of the same thing? I've been doing that for so long.
Yeah, so that's called lip reading, which is a component of speech reading. So basically, speech reading helps you to understand the speaker's thoughts by watching the movements of the face and body. And you're also going to be using situational and environmental cues to help you understand the semantic meaning of the words. Do you know what semantic means?
No.
Meaning of the words. It's fine.
The meaning of the word. That makes sense.
Yeah.
They always say that whole saying, like, it's just semantics.
Yeah,
okay,
that's where that
okay.
comes
Got
from.
it.
So how currently would you rate your speech reading skills?
I honestly don't know, because I feel like I've been doing it this whole time, and now you're telling me I haven't been doing it. But I can tell you that, I mean, I pretty much understand all the things that you're saying, because you're moving, and I get that, but now it's kind of like, no wonder I can't watch TV that well, because there's not movement, and there's the static, and all that other stuff.
Right,
that makes sense.
It's a process. So some things to consider when contemplating your speech reading skills are grammar knowledge. How well you understand visual cues for recognizing sounds of speech, such as when the lips are together on the speaker, and also an important factor is the visibility of facial movements on the speakers. So typically people who have beards are going to be a little bit harder to understand than people who don't have beards.
That makes sense. My husband has a beard.
Yes, that kind of gets in the way of being able to read the lips. Yeah. So then you're also going to look at cues for recognizing prosthetic patterns, like when your eyebrows are raised when you're asking someone a question. And a couple other speech reading factors to consider is the rapidity of speech. So the average speaker produces 150 to 250 words per minute. So it's very fast, and when you're not hearing all of the phonemes or speech sounds, that can be very difficult, and you're missing out on a lot of that. So this is our grad student. She's going to talk to you a little bit about that and some training techniques.
Okay, I actually have like a question I forgot to ask earlier. It's for you, the audiologist, but anybody can answer it. I remember you saying that it might take a while, like up to a year to hear kind of normal, but like my neighbor, I mean, he started hearing perfectly fine after 2 months, and that just makes me like, is there something I can do to be like him, or what can I do?
Just practice, and don't just get discouraged because you can't compare yourself to others. But as more you practice at home, outside, as your daily activities, you'll pick it up.
How do I get that practice? Like, are you gonna help me figure out how to do that?
We're gonna give you some exercises, and there's some on the handouts, and we're gonna practice one right now. It's the synthetic training one.
Oh, okay.
Yeah, so you can do after you practice here today. You can go home, practice your husband, your son, any friends you have. for at least 15 minutes a day.
Okay.
So for this exercise, I'm going to give you a sentence and you're going to use context clues to fill in the blank.
Okay.
So there's, for breakfast I had,
Eggs.
good job. And then we chopped for the fire.
Wood.
And in the morning, I brushed my hair and
Teeth.
there you go.
Okay.
And then I also want to talk to you about, because there's some sounds that you're going to have an easier time seeing, and some sounds you're going to have a harder time seeing.
That makes sense. Okay.
So the easier sounds are going to be p, b, m, and w, and then v, and th.
Okay.
And then the harder sounds are going to be k, g, t, and n.
Yeah, I don't know what you just said at the end, but I guess those are the ones that I can't hear.
You might also have difficulty with your vowel sounds.
Okay.
Because it's just based on lip movement.
Okay.
And some of them look a lot similar. But
Okay.
again, the more you practice, the better time you're going to pick it up.
Okay. Okay. Got it. Awesome.
And just remember, don't get discouraged and just keep practicing.
Okay. Thank you so much. It was nice to meet you.
too.
Not only do you need to take into consideration people you're interacting with on a daily basis, you need to also take into consideration your physical environment that you're interacting in. So over the next few weeks, I would like you to fill out this activity log and note any difficulties and improvements that you see in the environment.
When do I need to be back for? Do you know?
You'll be back in about 2 months. I would like you to fill out this log whenever you're in a restaurant or at the grocery store, wherever you find yourself having difficulty with hearing speech sounds, or you might find yourself having improvements. I'd also like you to please fill out this physical environment assessment before you leave today. That way we have a better understanding of where you are in each environment as your strengths and weaknesses are concerned.
Okay. I do know that I can hear like my family more now, but I feel like that's kind of just because I know my family, and like versus like when I'm out, like at a restaurant, like you said, and I know that I have issues with the TV still. I told the speech pathologist that's how you say it, speech pathologist.
Mhm.
Okay, the speech pathologist that, and I would like to enjoy TV with my husband now, you know, so I'm excited to do this. So if this is what it takes to fix it, then I'll do it.
Yeah. You can also put some subtitles on your TV programs you watch. That way you can read as you're watching people speak on the TV.
Yeah, I've done that, but you know when you live in a house, I don't know if you know, but you know if you live in a house with someone who doesn't like subtitles, it can become kind of like an argument, you know.
Yeah, and that's understandable. So that being said, I'm also going to provide you with a physical environment script that you can use to practice with your husband at home.
Oh, great.
Yeah, and the next time, just so you know, we'd also like you to bring in your husband.
Okay.
That way he's here for therapy, because not only does oral rehabilitation affect you as a patient, it also affects your communication partner.
It's definitely affected us, but he's very supportive, so.
Awesome, that is great, and that's going to be perfect for the optimal treatment outcome that everyone needs to be involved.
Okay, great.
Okay.
Thank you.
You're welcome. So it's nice seeing you today, and if you want to go out to the front and talk to the receptionist and schedule for 2 months, and we'll see you in 2 months.
Okay, thank you everybody. Have a
You're
great
welcome.
day.